In this video, we are going to discuss the different movements and activities that may take place within the bathroom. We will be going over how to get on and off the toilet and how to get in and out of the shower and tub after your knee replacement surgery. First, we will discuss how to get on and off the toilet. In order to get onto the toilet, you must back all the way up to the toilet, ensuring that the backs of your legs are touching the front of the toilet seat. Once you are close enough to the toilet, you will reach back to the toilet seat and slowly lower yourself onto the toilet. This step may be easier if you have handles or grab bars to reach back and hold on to as you lower yourself down. When you are ready to stand up, you will push up from the toilet seat or handles to stand. If this is difficult due to the height of your toilet, it may be helpful to have someone help you stand up from the toilet or for you to get some adaptive equipment to put over your toilet seat to increase the height. If you are using a walker, it is important to push up from the toilet seat and not grab the walker and pull yourself up. When first taking a shower or bath at home, there are many things to remember. First, it is important to check with your doctor to see how long you should wait before taking a shower. Additionally, before getting into the shower, it is important to practice getting in and out of the shower with someone there to assist you. This can make your first time showering much more comfortable and easy. Finally, if you do not feel comfortable getting in and out of the shower, there are alternative ways to clean yourself, like taking a sponge bath, that can be used until you gain more confidence. We will go over how to safely get into a walk-in shower first. There are a few different ways you can safely enter a walk-in shower. However, we will go over how to get into the shower backwards. First, you will carefully back up to the edge of the shower. Next, you will step backwards into the shower with your non-surgical leg first. Then, you will lift your surgical leg into the shower. When exiting the walk-in shower, you can either grab a grab bar or your walker for stability. Once you are steady, then you will step down out of the shower with your surgical leg first, then follow with your non-surgical leg. If you have a tub or tub shower combination at home, the approach to entering the tub will be slightly different. First, we will go over how to enter the tub if you have a tub chair. First, you will back up to the edge of the chair until the backs of your legs are touching the side of the chair. Then, you will reach back and slowly sit down on the chair. If you are experiencing knee pain or tightness, you can extend the surgical knee out as you sit down. Next, you will turn your body so that your leg is up against the side of the tub. Then, you will carefully lift the leg that is closest to the tub over the side of the tub. And then you will do the same thing but for the other leg. You may need to scoot over closer to the inside of the tub so that both of your legs will clear the side of the tub. When getting out of the tub, you will repeat the same steps but in the reverse order. If you are using a tub chair, it may be easier to lift each of your legs over the tub by using a leg lifter. This piece of equipment loops around your foot and is used to lift your legs more easily. You can use this equipment to get in and out of the tub like so. Finally, if you do not have a tub chair, then you will need to step over the sides of the tub while standing. The easiest way to do this would be to enter the tub sideways. First, you will walk up to the tub and turn to your side. If you have grab bars installed in your tub, then it would be best to face toward the grab bar so that you can use this for stability. Next, you will lift one leg at a time over the sides of the tub. When exiting the tub, you will face in the same direction and use the grab bar for stability to step over the side of the tub.